What is melena, and does it mean ulcer bleeding? Imagine seeing black, tar-like stools in the toilet and wondering what it could mean. That's what doctors call melena. It's a medical term for stools that are dark, sticky, and have a foul smell. The reason they look like that is because of blood that has been digested as it travels through your gastrointestinal system. When blood from an upper gastrointestinal source mixes with stomach acids and enzymes, it turns dark and gives the stool its characteristic appearance. Melena usually indicates bleeding somewhere in the upper part of your digestive tract, which includes the esophagus, stomach, and the beginning of the small intestine called the duodenum. This type of bleeding is often more serious than bleeding lower in the digestive system because it tends to be more significant and persistent. The dark color and strong smell come from the breakdown of hemoglobin, the protein in blood that carries oxygen, as it passes through your digestive system. This symptom is important because it suggests there has been enough bleeding for the blood to be digested and turned dark. If you see bright red blood in your stool, that usually points to bleeding lower down in your colon or rectum, which is different from melena. When it comes to ulcers, melena is often a sign that a peptic ulcer has started bleeding. Peptic ulcers are sores that develop in the stomach or the duodenum, often caused by infection with a bacteria called Helicobacter pylori or long-term use of certain medications like non-steroidal anti-inflammatory drugs. When an ulcer erodes into a blood vessel, it can cause bleeding. If the bleeding is slow, it might not be obvious at first, but over time, the blood gets digested and turns into melena. Patients with bleeding ulcers might also experience other symptoms like abdominal pain, nausea, or vomiting blood. The vomited blood can look bright red or like coffee grounds, which indicates fresh or partially digested blood. Blood loss from ulcers can also cause symptoms like weakness, dizziness, or feeling faint, especially if the bleeding is severe or ongoing. It's important to understand that melena doesn't always mean an ulcer is bleeding. Other upper gastrointestinal conditions can cause similar symptoms. These include gastritis, which is inflammation of the stomach lining, esophageal varices, which are enlarged veins in the esophagus, tears in the esophagus called Mallory-Weiss tears, vascular malformations, tumors, or injury from trauma. If you notice melena, it's a sign that you need prompt medical attention. Doctors will usually perform an endoscopy, a procedure where they use a flexible tube with a camera to look inside your stomach and duodenum. This helps identify the exact source of bleeding and allows for treatment, such as stopping the bleeding or repairing the ulcer. In summary, melena is a sign of bleeding in the upper gastrointestinal tract that has been digested, giving stools a black, tarry appearance. While it often points to bleeding from a peptic ulcer, it can also be caused by other conditions. Because it indicates bleeding, it's essential to seek medical care quickly to determine the cause and start appropriate treatment. Always remember, only a healthcare professional can provide a proper diagnosis and guide you toward the best care.